my name is Ms. Douglas, and I'm going to talk about smoking and the effects. Now, imagine you're a 15-year-old girl and your friend offers you a cigarette. At that point, you take the cigarette, and as years pass, you find yourself addicted. Now, you're 28 years old, you have a terrible cough, stained teeth, and you're 8 months pregnant. You're a single mom because your spouse has already passed. Now, you're having a difficult time with your pregnancy, your child is unborn, and though your child seems fine, he was born underweight and has a difficult time sleeping. Now, weeks pass, and as you check on that child, you walk to the crib and it looks like he's asleep, but you realize that he actually is no longer breathing and that he's died. Now, that story may seem extreme, but it's reality for many American smokers. Many Americans smoke, and cigarettes affect each individual in various ways. Now, it's been linked to cancer, heart disease, SIDS, and other ailments. If you do not smoke, you will have a healthier lifestyle than if you were a smoker. The effects of cigarettes are destructive, widespread. It harms many major organs of the body. Those that smoke have a higher risk of developing smoke-related diseases, stroke, and also respiratory illnesses. That's just a few of the things that it causes. First, I'm going to explore the effects of various cancers in connection to cigarette smoke. Cigarette smoke causes 87% of cancer deaths. Lung cancer is a leading cause of cancer death in both men and women. Now, according to the National Institute, these are facts. The effects of smoking in the lungs are devastating, and smokers have a higher risk of lower respiratory illnesses like bronchitis and pneumonia, and also a higher risk of asthma as they age. They can also develop throat cancer, which, if that happens, they will have to have their voice box removed, which is also referred to as the larynx. Smoking has prolonged effects on young women when it comes to teenage girls especially. Because they're still developing, it's very harmful for them. According to the National Cancer Society, teenage girls who smoke increase the risk of developing cancer actually before menopause. Because teenage breast tissue, they're still developing, and this makes it more susceptible to cancer-causing effects of the chemicals that's in cigarette smoke. Now, I'm going to talk about the birth defects on unborn and newborn babies. The effects begin in the womb, and that can happen when a mom is smoking or is around other smokers. Here's a few illustrations, some picture illustrations here of a mother smoking and the unborn child. Now, research from the March of Dimes states that smoking during pregnancy can harm the health of the woman and her unborn baby. Currently, 10% of women in the U.S. smoke during pregnancy, and that is very startling numbers when it has been related to SIDS. Now, the babies are more susceptible to the harm because they're still in the womb, and at that point they have no choice of whether they're around smoke or not. Studies from the National Cancer Society shows that low birth weight can result from poor growth before birth, preterm delivery, or a combination of both. Smoking has long been known to slow fetal growth. Premature and low birth weight babies face increased risk of serious health problems during newborn period. Chronic lifelong disabilities like cerebral palsy, mental retardation, and learning problems, even death. Now, the third area of effect that I'm going to speak about is secondhand smoke, which affects smokers and everybody around them. Children and infants who are still developing are affected most by this. Children may develop coughing, wheezing, breathlessness, or asthma. And the children that have asthma, actually it can cause asthma episodes in those that are already susceptible to asthma. Now, it has been the cause of SIDS, and infants developing do not handle the chemicals in cigarettes very well. And what that can do is it can cause them for the body to shut down, and a lot of times that can lead to death. Even adults cannot withstand the cigarette smoke very long. After time, they can get cancer and other coronary diseases and heart attacks and things like that. Now, after researching about cigarettes and the effects that have on smokers and other people, the damages and the secondhand smoke, and the correlation between cigarette smoke and cancer and birth defects, one might assume, who would indulge in this? Well, in conclusion, there are many people that choose to smoke in America, and it affects each individual differently, and it's based upon their lifestyle, their age, how they take care of themselves, how they eat, everything that concerns them. Now, their lifestyle is very much dependent, and also what the cigarettes do to them. With the diverse nature of chemicals used to develop it, is it any wonder why the effects are so widespread? Again, those that choose not to smoke will have a healthy lifestyle than if they did smoke. Now, is there any questions? Well, thank you for sitting through my presentation, and have a nice day. This is my audience here. Once again, my husband, my sister, and my daughter. And I don't know if you want to see the pictures, but these are the pictures, the illustrations that I use. I don't know if you can see them very well, but it's someone smoking, kids smoking, pregnant woman smoking, and an unborn child, and then